Before we dive in, this video is for general information only and is not a substitute for medical advice. If you have any concerns about your liver health, please speak to your GP or a qualified healthcare professional. Can castor oil actually help treat a fatty liver? The short answer is no. And it's worth understanding why, especially if you or someone you know has been diagnosed with fatty liver disease. Fatty liver disease is surprisingly common in the UK. It happens when too much fat builds up in liver cells, and it's closely linked to obesity, type 2 diabetes, and metabolic syndrome. Many people don't even know they have it because in the early stages, it often causes no symptoms at all. That's part of what makes it so important to take seriously and to make sure you're relying on treatments that actually work. So where does castor oil come in? It's been used traditionally as a laxative, and you'll find plenty of online claims suggesting it can support liver health or help with fatty liver disease, including so-called castor oil packs applied to the skin. But here's the thing, there is no clinical evidence to support any of those claims. Castor oil has no licensed medical use for liver conditions in the UK, and it is not recommended by the NHS or NICE. No peer-reviewed clinical trials have demonstrated that it's effective for fatty liver disease, whether taken orally or used topically. Castor oil packs also lack clinical evidence and can cause skin irritation. It's also worth knowing that castor oil isn't without risk. As a laxative, it can cause diarrhea, dehydration, and electrolyte imbalances, which may be harmful if your liver is already under stress. And perhaps most importantly, relying on an unproven remedy can delay the lifestyle changes that research shows can genuinely make a difference. And in early stage fatty liver disease, those changes can actually reverse the condition. So what does the evidence support? The cornerstone of fatty liver treatment is lifestyle modification, dietary changes, regular physical activity, and weight management where relevant. These are the interventions that NICE and the NHS recommend because the evidence behind them is strong. In terms of diagnosis, your GP may arrange blood tests to check your liver function and rule out other causes such as viral hepatitis, thyroid problems, or medication-related liver injury. An ultrasound is usually the first imaging test used to detect fat in the liver. Your doctor might also use a fibroscan, which measures liver stiffness to help assess whether there's any scarring or fibrosis. NICE also recommends a scoring tool called FIB4 in primary care to help assess fibrosis risk, and if further assessment is needed, you may be referred to a hepatology specialist. If you've been told you have fatty liver disease, the most useful conversation you can have is with your GP or a specialist. Ask about dietary changes, physical activity, and whether further tests are needed. If you're currently taking castor oil or any other supplement, let your doctor know. It's important they have the full picture. When should you seek help more urgently? If you notice yellowing of the skin or eyes, swelling in your abdomen, confusion, or any signs of gastrointestinal bleeding, please contact a healthcare professional promptly. These can be signs that the liver needs urgent assessment. To recap, fatty liver disease is common and often silent in its early stages. Castor oil, whether taken orally or used as a topical pack, is not a clinically supported treatment, and using it carries its own risks. The treatments with real evidence behind them are lifestyle-based, and the earlier you act, the better the potential outcomes. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. Give this video a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information, and always speak to your GP or a qualified healthcare professional for advice that's tailored to you.